My name's Monica Schwartz. I'm an endocrinologist at Westchester Medical Center, located in Valhalla, New York. Today we're going to talk about thyroid disease. A little background about the thyroid. The thyroid makes hormones that are chemical substances, and they're produced and secreted by the thyroid gland. They're essential for metabolism and normal development. There's 3 types of thyroid hormones: T4, thyroxine, T3, triiodothyroxine, and calcitonin. What is the thyroid? The thyroid is a small gland located in the center of the neck above the clavicle. It's crucial in the endocrine system, and it works with other glands to regulate many functions in our body, including metabolism. The 2 hormones that work to regulate our metabolism are T4 and T3. Calcitonin, which is also produced by the thyroid, regulates calcium along with other hormones, but does not directly involve itself in metabolism. All of our cells depend on thyroid hormone to function properly. Production and secretion of thyroid hormone is regulated by a complex system that includes regulation by the pituitary gland located in our brain. When the body detects a need to make more thyroid hormone, T3 or T4, it inhibits the production of TSH, thyroid stimulating hormone, which is produced by the pituitary. The pituitary is in charge of stimulating the thyroid in turn to produce T3 and T4, constantly regulating and supplying the correct amount of thyroid hormone to all the cells in our body. An important component in synthesizing thyroid hormone is iodine. It's important that iodine be present in proper amounts to produce thyroid hormone. Thyroid hormone can affect many systems in our body, including heart rate, cholesterol levels, weight, energy levels, muscle strength, skin, turgor, and menstrual regularity. Our nervous system, including our memory, reflexes, are also regulated by the thyroid system. The thyroid is essential in proper development and growth, and also in regulating our central nervous system. It can also affect how we process food and cholesterol. When these functions are altered, thyroid disease ensues. Common thyroid diseases include hypothyroidism, or not enough thyroid hormone, hyperthyroidism, too much thyroid hormone, a goiter or an enlargement or growth of the thyroid, thyroid nodules, and lastly, thyroid cancer. Hypothyroidism is a common disease occurring in almost 10% of the population. It's more common in women than men, and the most common cause is Hashimoto's disease, which is an autoimmune disorder. How does it manifest? Thyroid symptoms are quite vague and nonspecific and can be confused with many other disorders. At the muscular level, there might be fatigue or weakness. There's often changes in the skin, dryness, an inability to sweat, feeling cold when others feel hot. It's most important to notice how you feel now as compared to how you used to feel. The neurologic system has many variations, symptoms, and is also quite nonspecific. One might feel depressed or anxious, or have changes in memory. In females, menstrual irregularity is quite common. In addition, fertility problems may present themselves. The digestive system may also be affected, most commonly manifested by feeling constipated. How do you diagnose hypothyroidism? Well, symptoms, like I said earlier, cannot be the best way to diagnose it, as they're usually quite vague and nondescript. There's no characteristic symptoms. It's often necessary just to note changes that you feel now versus how you felt several months prior or even a month prior. It's important to talk to your doctor about medical and family history. For example, if you've had any changes in your health, if you've had thyroid surgery, if you've ever been exposed to radiation or you've had radiation yourself. The medications that you take can often interfere with thyroid metabolism, thyroid production. It's also important to talk to your doctor if any family members have had thyroid disease, including hyper or hypothyroidism. A physical exam will tell your doctor about your vitals, your heart rate, your temperature. If you have a swelling in the thyroid gland, blood tests will be of most importance to diagnose hypothyroidism. Often the TSH, thyroid stimulating hormone, will be abnormally elevated and the T4 may be decreased. It's important to know that blood tests require special proteins that are bound to the thyroid hormone, and more than one test might be necessary to diagnose hypothyroidism. How do we treat hypothyroidism? Hypothyroidism can't be cured, but in almost every patient we can replace the thyroid hormone that's not being made with T4 or levothyroxine. Levothyroxine in general is synthetic, but it's also bioidentical to what our body produces in the form of T4. All hypothyroid patients, save the sickest ones, can be treated in an outpatient setting. Are there side effects and complications to treatment? The only dangers are caused by over-replacing or under-replacing the thyroid hormone that is necessary in a hypothyroid patient. Under-replacing will cause the hypothyroid symptoms and signs to continue, and over-replacing will cause a state of hyperthyroidism, affecting heart rate and affecting metabolism in general. Let's talk about hyperthyroidism, which is the excess of thyroid hormone in the blood. As we talked about before, thyroid hormone plays a significant role in many processes of the body. If you have too much thyroid hormone, it will cause your metabolism or all the body's processes to speed up. Some of those symptoms that might ensue are nervousness, irritability, increased sweating, feeling your heart racing, feeling your heart palpitating, hand tremors, anxiety, difficulty sleeping, thinning of the skin, excess sweating, fine, brittle hair, and weakness in your muscles. You might have more frequent bowel movements or even diarrhea. You might lose weight despite doing what you normally do. And women might have irregular periods as well. In the beginning, people that have hyperthyroidism might feel like they have more energy as their system is speeding up. But over time, the body begins to break down, and fatigue and being tired is very common. Hyperthyroidism can present slowly over several months, or it can present quite quickly. At first, the symptoms might be mistaken for just being hyper or nervous, but over time, the patient will begin to feel sick and will come to medical attention. The most common cause of hyperthyroidism is Graves' disease, and Graves' disease is an autoimmune disorder. Sometimes it's associated with eye findings, causing swelling of the eyes or upper lid retraction that may make the eyes look large. Often people might have an enlargement of the thyroid gland or a goiter that might be noticeable. In hyperthyroidism, family history is important, especially in autoimmune disease. Little is known why patients might get this disease, but it often tends to run in families and often occurs more in young women versus others. There are other conditions that cause hyperthyroidism, which is an excess of thyroid hormone. One might be destruction of the gland via thyroiditis, which may be due to a viral illness or a situation in which there's a destruction of the gland. Another might be a thyroid nodule that is producing too much thyroid hormone, or a toxic nodule. Hyperthyroidism might be temporary in a condition called thyroiditis and may resolve on its own as well. It's important to follow closely with your doctor to determine the cause and to determine resolution. How do you diagnose hyperthyroidism? Most importantly is lab work, figuring out if your thyroid hormone is elevated. Also measuring thyroid stimulating hormone will help your doctor determine the cause of the hyperthyroidism. In addition, he or she may order antibodies that help determine if the hyperthyroidism is autoimmune. Remember that blood test might require more than one determination because proteins are important in measuring thyroid hormone. How do you treat hyperthyroidism? The treatment depends on lowering the amount of thyroid hormone that is produced. Commonly, we use anti-thyroid drugs if Graves' disease is the cause of the hyperthyroidism. We also use radioactive iodine to decrease the amount of thyroid hormone produced. And surgery sometimes is an option to remove the thyroid gland and decrease the thyroid hormone amount quickly. If the cause of hyperthyroidism is due to an inflammation, which may resolve on its own, or medication, those changes will also be addressed by your doctor. Thyroid nodules. Thyroid nodules are very common, and people over the age of 60 have a 50% chance of having a thyroid nodule. Fortunately, more than 90% of these nodules are benign. Hashimoto's thyroiditis, or hypothyroidism, is often associated with thyroid nodules. And iodine deficiency, which is very uncommon in the United States, may also cause thyroid nodules. Once a thyroid nodule is discovered, your doctor will try to determine if the rest of your thyroid is healthy. They will first check thyroid hormone levels and then may determine if your thyroid gland is enlarged and may order a thyroid ultrasound. The thyroid ultrasound and the lab test will not determine if your thyroid nodule is cancerous. If the thyroid ultrasound shows that there are concerning characteristics, you may be prescribed to have a fine needle thyroid aspiration. This aspiration is done with the help of thyroid ultrasound and is often done at the bedside at your doctor's office. The thyroid ultrasound is a key tool for thyroid nodule evaluation. It uses high-frequency sound waves to determine if the nodule is solid or fluid-filled, and it can also determine the exact size of the nodule. It helps us determine if a nodule appears suspicious or if it appears benign, and helps your doctor move forward with the diagnostic. How do you treat thyroid nodules? Most thyroid nodules, as we discussed, are benign and will be followed over time. A benign thyroid nodule that is growing or becomes suspicious over time may be significant enough to consider removing surgically. And that small percentage of people that develop a thyroid cancer will be referred to a surgeon also to remove the thyroid. Either way, patients that have nodules will be followed every 6 to 12 months by their physician and possibly will have an ultrasound at that time to determine if there's any growth or anything concerning that happens. The bottom line is that it's extremely important for patients with thyroid disease to follow with their clinician so that any changes and any determinations can be made in a timely manner. Thank you.